Mr. Jones is a 65-year-old patient who was admitted yesterday for dehydration and after having a fall at home the day before. He's alert and oriented times 4, and he prefers to walk to the bathroom instead of using the bedpan. He's also resistant to ambulation assistance, even though his order states that he should only be up with help. His current orders include vital signs every 4 hours, a regular diet, strict intake and output, and a peripheral IV running D5 half normal saline at 100 millimeters per hour. He also has Tylenol 650 milligrams by mouth every 6 hours as needed for pain and metoprolol for 500 milligrams by mouth daily for hypertension. Your turn.
You don't want to do the RN right now.
Oh, I can. Okay, so the RN is responsible for the highest level of assessment, meaning that they perform the full head to toe assessment. And they interpret what the findings actually mean for the patient. RNs also provide teaching like medication education, safety instructions, and explaining what happens if a patient refuses treatment. Another key responsibility is delegation. They are in charge of assigning CNAs, UNP, and LVNs and LPNs and what they're able to do within their circumstances. They follow the plan, but the RN is the one who creates it based on the patient's need. They have RNs also supervise the LVNs and CNAs to make sure that everything is safe and they are within their role. And finally, the RNs use clinical judgment to make decisions, clarifying medication orders, and escalate changes in patients' conditions to the provider. Overall, the RN scope focuses on higher level decision-making, teaching, and managing the entire plan of care.
So CNAs assist with activities of daily living, especially for this patient due to previously having a fall. They're going to be needing assistance with bathing, toileting, hygiene, and dressing. They're also going to provide assistance with ambulation only when the patient gets up. Based on the scenario, they want to be able to do the ambulation on their own or with minimal help, so it'll just be while they're getting up. They're going to perform vital signs every 4 hours and then notify LVN or RN of abnormal findings and then report to the RN if something is out, like blood glucose, things like that. Measure I's and O's is very important for the vital signs on this patient, and then observe and monitor for safety, making sure that the room is clean and clear of clutter, making sure that there is not a fall risk, and then being able to set and remind to set the bed alarm every time that that they leave the patient by themselves in the room. LVNs are able to administer oral medication, so the metoprolol, 50 milligrams by mouth daily, and then the Tylenol, 650 milligrams Q6 by mouth, are able to be prescribed or administered by the LVN for pain management and then for blood pressure. Monitoring the IV site, making sure that there's no rash or irritation, and knowing what those signs look like, performing focus assessments on blood pressure and hydration based on why they were admitted, and then follow the care plan that the RN prescribed to the patient by teaching them the given instructions that the RN already implied to the patient, and report abnormal findings to the RN that are important to monitor. And yeah.
Okay.
And my name is Sarah Tillery,
And I'm Melissa Hernandez.
and that is our scope of practice.